Hello, everybody. Thanks for joining us today. This is going to be our second webinar in the QCDR series. This one's going to be called Navigating the NRDR and MIPS Portals. And it's going to be presented by me, Zachary Smith, and Priya Sharma from our operations team in the Quality and Safety Department. What we're going to cover today, we're going to start off by looking at the new QPP Eligibility and the Measure Lookup tools that CMS has just released. Those are going to be useful for helping you check your status, whether you have to participate in MIPS, and then help you kind of develop a plan to start your MIPS participation. Then we're going to do a live demo of the NRDR portal. We're going to talk about some common account setup errors that people have had over previous years. Then we're going to do a demo of the MIPS portal and show you how to submit your MIPS data and how to review your MIPS performance reports. We're also going to quickly go over our NRDR help desk. I know a lot of you are already familiar with that, but we just want to show some resources that we have available on that page. And then finally, we're going to wrap up talking about some important deadlines for QCDR. So CMS recently released these for 2018. They've got the QPP Eligibility Lookup tool available. That's going to be where you can enter your NPI to determine whether you're required to participate in MIPS for 2018. And one nice thing about it, it's also going to show you what your patient-facing status is. So as you know, whether you're considered patient-facing or non-patient-facing can determine whether you're supposed to participate in certain categories and how many improvement activities you have to submit. So I'll pull this up really quick for you so you can see. So this is the QPP Lookup tool. You see here, you can just enter your NPI number, and then that's going to tell you all the information that you need to determine if you have to participate in MIPS. They've also recently released the Measure Lookup tool. Until recently, it was still showing their 2017 data. So this is really useful because they've updated it with the 2018 measures, they've updated it with the new improvement activities, and also the promoting interoperability measures, formerly known as advancing care information. So as I said before, you can use this to kind of plan out what measures, what improvement activities you're going to submit, just kind of develop your MIPS participation plan. So that's what this page looks like. You can choose your performance year. In this case, it's 2018. We'll start off looking at the quality measures. If you scroll down here, you can filter by the specialty set that you want to see. So I'll go down and select the diagnostic radiology measures. And as you see here, it's going to pull up all the measures under the diagnostic radiology set. When you find a measure you want to use, you can just add it to your list. And then you can also download the measures that you've selected. Now, just to be clear, this isn't any sort of official MIPS participation tool. It's just designed to help you look at the measures that are available and decide what might be best for your practice. So it's totally unofficial, but it's still a very helpful tool. So we're about to start our NRDR portal demonstration. So just an overview of NRDR and QCDR. The QCDR and the MIPS portal gives radiologists the ability to collect MIPS data. You're able to submit your MIPS measures through the MIPS portal. You can select your improvement activities, and you can select your promoting interoperability measures. You can also monitor your performance. So throughout the year, the MIPS performance report portal is going to be updated pretty much live with the MIPS measures you submit and the QCDR measures you've submitted. So within about 24 hours of you submitting data, you'll be able to look at your performance rate for that point in the year for each measure you're submitting. And finally, the CMS Submission tab is going to let you report your data to CMS. And you can report either as an individual or as a group practice. And finally, just a reminder that anybody participating through QCDR is required to submit data for both Medicare and non-Medicare patients. So I'll go ahead and turn it over to Priya Sharma, and she's going to do a demonstration of the NRDR portal. Thanks, Priya.
Okay. Hi, this is Priya Sharma in Operations for Quality and Safety. We're just going to go over some of the QCDR participation requirements. So facilities or groups must have a signed participation agreement for the MIPS registry. If you've previously used the NRDR's QCDR, we don't need a new one for this reporting year. Physician, MPI, and TIN information are required on all accounts, not just the master facility. So if physicians want to get credit for some of the non-MIPS registries, physicians and TIN information would have to be added to those specific registries and facilities. You would have to monitor your performance via the feedback reports and the MIPS portal. And doing this regularly will ensure that data is being received properly. To use the QCDR, some data must be submitted by October 31st, but we definitely recommend that you start early to help troubleshoot any issues or errors that you may encounter. And then you would also have to indicate whether your facility's TIN or your facility is reporting as GPRO, which is group reporting. And if you're unsure when you're first adding your TIN about whether you're doing this or not, you can always go back and edit that information. So some of the most common errors that we find when participation in MIPS is occurring is that registration has not been accepted. So people will add MIPS registry and they haven't yet submitted an addendum or an agreement, so those registrations have not been accepted and you won't be able to submit any data. Another one is child facilities do not have MPIs listed or the TIN association for physicians. The child facilities are not registered in MIPS, where they will also have to have MIPS registration. One of the most common problems is for groups with large number of physicians, they try to use the template and it doesn't load correctly based on some of the errors that they might have submitted. And we can definitely go over that and help troubleshoot those issues. And that physicians are not registered in the MIPS portal, which is different than enrollment. So a lot of people think that once you've added your physician and enrolled them in MIPS, that's all that would have to be done. But there's also a registration process. And one of the biggest errors in the last season was that data for CTC, DIR, lung cancer screening, GRID, NMD, or IR was being submitted to the master and not the child facilities. And this data has to be submitted at the child facility or those will not pull to your account and it won't be attributed to the TIN and MPIs. And now we will go through the live demo of the portal and the template. So to see if you're registered in MIPS, you would click on registration on the left side menu. And if you see MIPS on your screen and there's a no next to it, it means that we haven't received the participation agreement or addendum. You just either have to send in that addendum or you would have to email us and say, hey, we have submitted this agreement and MIPS isn't accepted, so that we can go ahead and accept registration. If you don't see MIPS listed here, you would just come to the registration page and hit continue. Once you hit continue, you'll see a list of registries applicable to you. Check off MIPS and hit register. The next most important page that you would have to look at is the Manage Physician Group TIN page. Your TINs must be shown here on this page. You would have to have, when adding a TIN to this page, you would have to add an available from date. But if your TIN is still an active TIN, you would not have to put a to date. You would be able to check off the list of child facilities as well if you're on the master. And you would be able to uncheck or check what registries this TIN should be active for. You would add it and then scroll to the bottom and save your TIN. Next, the other biggest issue would be managed physicians. If you click on the managed physicians, if you're on the master, you'll be able to see all your physicians for the master and all child facilities. You can sort by facility ID, or you can sort by last name, first name, or MPI if you're trying to see who's listed. There's also a search function where you can search for a physician if you're looking for them. Next, I'm going to show you some common template issues. I pre-filled this template with some physicians, and you'll notice here in the first name we have Bruce J. Normally, middle initials are not required, and it'll kick back an error. Another common error is that people will swap the first name and last name on the template, or they will use a nickname. As here, you see Don, and it should be Donald. That will not load into the system. Another common problem is that people will put X's in the columns instead of a Y, and that will also not take. You either need an X or you either need a Y or nothing in these fields. So if we try to load this template, we'll receive a log file, and you can click on the log to see what your errors are. In this case, it'll show that we have an MPI error and we have a missing Y value. Also, it shows for Don Rosen that we haven't put in his full MPI registered name, and it should be Donald. So then we can make the updated entries. So now we have Bruce Hillman, Donald Rosen, and we now have Y's in the corrected fields instead of X's. We can load this template, and we'll now get the file is loaded successfully. Once the physicians have been enrolled, they'll receive an email, and the email will show with a registration link. This physician most likely does not already have an account, so they would click no, they do not have a registered account in the NRDR portal. They would be able to create their username, and all usernames must be unique. So if your username is taken already, it'll tell you to create a new username. You'll also enter a password. And then you've logged in. The next step that physician users would have to do is go to the MIPS Participation Portal, click on Data Collection and Reports, and they're brought to a screen where they have a list of 6 questions. This physician's already been enrolled, so it wouldn't show that list of 6 questions, but they would just click on those 6 questions, update it, and hit register. And that is it for the most common errors for the portal.
All right, thank you, Priya. Now we're going to talk about the MIPS portal specifically. So the MIPS portal is where QCDR participants can go to manage the process of actually submitting their MIPS data, managing their MIPS data, and looking at their performance reports. So the MIPS portal provides the location where you go to upload your MIPS file templates. It shows where you can review your performance data for MIPS and QCDR measures, and also compare them against CMS benchmarks. And it's also where you can go to select the measures and improvement activities that you want to actually report to CMS on the CMS Submission tab. And it's going to show you physician level and group level performance data. So, depending on whether you want to report as a G-Pro or as individual physicians, you can look at how your data stacks up for both of those. To actually access the MIPS portal, you'll want to go to the NRDR portal, log in with your normal username and password, and once you're logged in, you'll go to the MIPS participation portal and then click on Data Collection and Reports. And if I could be made presenter. Okay, so this is our test version of the NRDR homepage. So this is pretty much what you'll see when you're logged in as facility administrator or registry administrator. And the link for the MIPS participation portal is here under registries. So you'll open that up, and then you'll see this page. And this is where you'll click on Data Collection and Reports. Now, I should mention, since this is our test page, some of the data hasn't been, or some of the text hasn't been updated to reflect the new performance year. So these still have 2017 dates and deadlines, but the actual version is it's gonna refer to this year's dates. So once you click on Data Collection and Reports, you'll see this. And this will actually take you into the MIPS portal. So this is where you can check on all of your MIPS data, check on how you're doing on your measures, what improvement activities you've selected, and what promoting interoperability measures you've selected. One helpful thing to look at, this is just here on the home page of the MIPS portal, is if you scroll down and find your 10, you'll see a list of all the physicians that are enrolled in MIPS for that 10. So here we've got these two physicians listed, and under registered it says true. As long as it says true under the registered column, that means that physician is good to start reporting MIPS data under their NPI. Something that's going to be a little different this year from last year is the physicians are no longer going to have to log in themselves and complete the MIPS attestation. That functionality isn't in place yet, so if you're adding physicians right now, they'll still have to do that. But once we implement the new version of NRDR, probably around August this year, once you've uploaded the template, as Priya showed you, they will be considered registered. So they're not going to have to do anything else at that point. They'll be good to submit MIPS data. So for now, this is just a good way to check and make sure they are considered registered, fully attested for MIPS. Now, when you're ready to upload data, which this functionality is available now, so if anybody's been waiting to start submitting MIPS data, you can start whenever you're ready. This is the page where you'll submit your files. And the files that we use, we've got Excel and text templates. The Excel template looks something like this. You're probably mostly familiar with it, but for anybody who's new to this process, I'll open it up and show you what it looks like. I'm just waiting for that to load, but I'll go ahead and show you the Excel file specification. So this is the document you're going to want to refer to make sure you're creating your MIPS files correctly. The template just loaded, so let me show you what it looks like. It's a very simple Excel file. It's just got column headers for every field that needs to be provided for each MIPS measure. So hopefully you can see my screen here. I'll try to zoom it in a little bit to give you a better idea. But when you fill this template out, you're going to be providing things like the exam date and time, the physician group 10, the physician NPI, I know it's looking a little weird. Okay. Physician NPI, the patient ID, patient age, gender, whether or not they're a Medicare beneficiary. You're going to provide the measure number, the CPT code for the denominator, and then some of these columns might not be required for every measure. For example, column K is the denominator diagnosis code. Not all measures have diagnosis codes for the denominator, so you may or may not have to fill that one out. Then column L is for the numerator response. So every measure has a denominator and a numerator when you're entering the cases. And then some of these other fields are also contingent on what measure you're submitting. So you'll fill this file out according to those specifications. So this document will show you every field that's required for the template. And then here, there's sort of an explication of what each of those fields means. So exam date and time, or just date and time of the service, and then it's going to tell you whether that's required. So this is every single column on the template, and then all the information you need to know about how to format it, whether it's required, whether there's a maximum length of characters. So this document is indispensable if you're going to be submitting MIPS measures through the portal. And there's a similar file for the text file. If you choose to upload a text file instead of an Excel file, we've got a text file specification document as well. So this is available both on the MIPS portal under the Upload Data screen, and also it's just linked on our QCDR homepage, which is acr.org/QCDR. So it's got links to both the file templates and both the specifications for the different file templates. Now, once you've created a file, you can go here, click Upload, or choose your file, and then upload it. And then it'll give you a status, as you can see here. It's going to show you whether the file was uploaded successfully, whether it was rejecting, or any other issues you might run into. And our next webinar is going to go into a little more detail on how to submit data for MIPS and how to submit data for QCDR measures, the ACRAD measures. So stay tuned for that one if you've got questions about that process. That'll be in August. Now, we've also got tabs here for submitting your improvement activities. You can go here, I'll find our test site. And you can click on the Review Improvement Activities button to add or remove activities for every NPI or for every Group 10 if you're reporting as a G-Pro. So if anybody did this last year, this section hasn't really changed. You'll scroll down to find the IA you want to submit. Say you're doing leveraging a QCDR to promote use of patient-reported outcome tools. You'll enter your start date. And remember, these have to be at least 90 days each. So I'll go to April 1st. And once you've entered a start and end date of at least 90 days, you can click Add, and then that will add it to your report. Once you're done, you'll click Save. It'll indicate that it's saved successfully, and then you can go back either to the CMS Submission page or just back to the IA Summary page. So I'll take it back to the IA page. And then the activity I added will show up next to the doctor we selected it for. We've also got, this is going to be the Promoting Interoperability section. As you know, they changed the Advancing Care Information, they changed the name of it. The content of it is basically the same, but now it's called Promoting Interoperability. So similar to the Improvement Activity tab, we've got a way here to add the promoting interoperability measures for each of your physicians. So I won't go through this whole process, but this is available under your MIPS portal. Finally, the most important part I wanted to talk about is the performance report. This is a great way to gauge how you're doing as far as the measures you've been submitting, and also whether your data is coming through correctly. A lot of people had questions last year about their ACR measures, the ACRAD measures. They would check their performance report, and then the numbers they were seeing wouldn't reflect what they expected to see. So it's a really good idea here to check this regularly, and it's available to you all year round. So we encourage you to check this all the time just to see how your measured data is coming through and if it all looks correct. So as you can see here, you'll find the 10 that you want to look at, expand it, and then it's going to show you each measure that's available and each NPI that's associated with that measure. It's going to show you the initial patient population, so how many records you entered for that measure, how many were part of the performance denominator, and then how many were performance met or performance not met in the numerator. Then it's going to show you the performance rate here, and as you can see, it'll show you both the group performance rate, that's this top row here, as well as the individual. So whether you're reporting as a GPRO or as individuals, all the information that you need will be here on this page. And here at the bottom, you'll see the CMS benchmarks for each measure. So this will give you an idea of what decile you're going to fall into, and therefore what kind of score you're going to get for that measure if you select it. So again, this page is really just a summary of every measure you've submitted, whether it's MIPS measures that you're reporting through the MIPS measure template, or if you're reporting ACRAD measures, say through the dose index registry or the grid registry, all of those measures you've submitted will show up here. And finally, early next year, when you're ready to select your measures after you've submitted all of your 2018 data, you'll be able to go to the CMS submission page. You'll be able to review the information all over again, look at what measures have been selected for each group or NPI, look at what IAs are attributed to them, and then submit that data to CMS. Obviously, the functionality for this tab isn't available to you yet because the year isn't finished, so this will become available early next year when it's time to wrap up your CMS submission and get everything submitted to Medicare. And we are working on revamping this page a little bit so that it's hopefully going to be a little more intuitive to use than it was last year. So look forward to that. And that's about all I wanted to show for the MIPS portal. So we'll hand it back over to Priya's computer here. Oh, God. Great. Okay, so if you'll show your screen. All right, perfect. So before we get into the NRDR support page, here are the key takeaways from the demos that Priya and I have just done. You want to make sure you've registered your facility and all of your physicians in the NRDR portal for MIPS. So she showed you how to check that under your registration and how to look at your managed physicians page to make sure all of your physicians have been correctly entered. Then you'll want to review the data submission requirements and processes. We've got links to those documents on our QCDR homepage. So that's going to link you to all the available measures and then the measure specifications for each of those. You'll want to monitor the MIPS portal to view your exam counts and your performance data. And most importantly, if you do encounter any discrepancies with your data when you're looking at your performance report in the MIPS portal, you want to make sure you notify ACR so we can look into that and help you correct that with plenty of time to spare before it's time to submit to CMS.
So we have NRDR support, which is our help desk, and it's a website. And on NRDR support, the website is nrdrsupport.acr.org, and when you reach the website, you have a search field at the top where you can enter any subjects, or you can just scroll to find what category you're looking for. You can scroll down to find submitting MIPS data, where you'll have all the sections regarding MIPS, or you can just type into the search field MIPS and see what articles come up in that subject. So the top few articles are about general NRDR, QCDR validation plan, file specs, and uploads. So if you click on any of the articles, you'll also see the related articles that might also be of use to you. We have a common MIPS data file errors, which should help a lot of facilities. We also have instructions on how to enter your physicians into the Excel file, and common physician data upload errors, which are pretty common to help assist facilities. You can submit a ticket using the new support ticket, and you would want to be as specific as you can. Try to include a facility ID number. You would put your email in. Providing an ID number will get you a faster response. You can select what category, if it's QCDR. If you're having problems with the measures, flat file upload, you can cater it to what you think your ticket should be about. The more information you provide will hopefully help us resolve your issue faster rather than going on a back and forth to try to pinpoint your problem or error. For file upload troubleshooting, do not attach the files via email or to the ticket. It's not a secure method, it's not encrypted, and we do not want PHI coming in either of these ways. For the most part, for troubleshooting the files, we would just need the file name in your email or ticket. You can also, if you don't want to use the ticket, you can also send an email to NRDR support@acr.org, and it'll create a ticket for you as well. The email nrdr@acr.org is not used. So to get the fastest assistance, please use NRDR support or the NRDR support email.
All right, thank you, Priya. And when we send this slide deck out to everybody that's registered for this webinar, you might want to take a look at this slide. This is just a link to some of the articles we have on the help desk that are especially relevant for getting started with QCDR and then for getting your data submitted. So take a look at those links when we send this out with the recording later. That'll probably be early tomorrow that you'll get that. This is just a list of several websites and resources we have on our page and some offsite links too. This is our QCDR homepage, our NRDR homepage, a link to the portal, a link to the help desk, and then here are some core documents for your MIPS participation. So this will link you to the measures and to the improvement activities and other relevant files for getting your data submitted to us. And I also want to point out we've got links to upcoming webinars and recordings of previous webinars available on our QCDR homepage. So if you want to go back and look at our webinar from last month, we've got that available on the QCDR homepage. Just scroll down the page a bit and you'll see it there. And also registration links for our upcoming webinars. I just wanted to go over the overall QCDR timeline again, just to remind everybody where we want you to be at certain points of the year. So by October 31st, we want to make sure that you've registered for MIPS for every NRDR facility that intends to participate, and that you've started submitting data for each registry you intend to use. So if you're going to submit MIPS measures, make sure you're submitting MIPS measures already. It doesn't have to be a full year of data at that point. Just want to make sure you've submitted some files and made sure that they're coming through correctly. Same goes for if you're submitting DIR data, grid data, NMD, any ACR registry. If you're planning to use those measures for MIPS participation, make sure you've started submitting data by October 31st. Then by November 30th, you want to make sure that your accounts are all completely set up correctly as far as what TINs are involved and what physicians are going to be submitting data and the locations of each of those facilities. So by the end of November, make sure that all of your accounts are totally set up correctly. And then by the end of January 2019, we want you to have finalized your data submission to us. So all of your measure data, whether it's for MIPS or for QCDR measures, make sure you've got that submitted by January 31st for all of 2018. Around the middle of March, you'll be invoiced for the MIPS fees. So again, that fee is per physician who's participating in MIPS, and that's also your deadline to finalize your measures and your improvement activities. And so at that point, you'll submit your data to CMS, and then it's all done. And the absolute deadline for that is March 31st. CMS will not accept any measure data after March 31st for the 2018 reporting year. Here's a link to our upcoming webinars. We've got one on August 9th for the QCDR data submission requirements and feedback reports. We've got one October 11th. That's about preparing for the 2018 MIPS data submission deadlines. And then in mid-November, November 15th, we've got avoid costly errors, submitting QCDR data accurately, and understanding performance reports. So each of those webinars is going to be useful for getting your data submitted and making sure your reports are looking good. We'll probably add at least one more webinar around September, so we'll notify everybody of that too. Finally, here's another link to contact us. This is a link to the NRDR support page or the NRDR support email, or you can always call us on our phone line at 800-227-5463, extension 3535. Now we've got about 20 minutes left for Q&A, so if we've got any good questions, let us know, and we'll answer this for you. You can always type questions into your chat box, or you can hit the hand raise icon on your GoToWebinar tab, and we'll see that your hand's raised, and we can unmute you if you want to ask your question on the line.
All right. I don't see any hand raises so far.
Any good questions that have already been answered we can talk about?
Katie Sarah asked if we could review how to fill out the ACI portion if you're non-patient facing, and the response to her was if you're non-patient facing, then you're exempt from that promoting interoperability category, and you do not need to submit any information in that category. You just ignore that in the MIPS portal.
Yeah, you'll skip over that tab entirely if you're exempt from it.
Someone else asked if we did this last year, meaning submitted data for 2017, do we have to re-enroll and re-register? And the answer is no. If you enrolled for MIPS and submitted data last year, then you do not need to re-enter your TIN or NPI associations, and the registry is going to be active in your account for 2018.
But remember that if you do add new physicians, these new physicians would have to be registered.
Correct. Here's a new question. If we want to be sure we have paid all applicable fees for each registry, including MIPS, where do we find that information on the website? I believe it's under, Priya's looking at me like I don't know.
It is easier for you to submit an email to see all of that, because then somebody can take a look at detailed accounting records. A lot of the time facilities have started under one facility. They may have changed their master. So to ensure that we have all of your payments on file, an email would be the easiest way to find that out.
Lynn Shepard asked if there will be a 10,000 record limit on the upload files this year.
Well, we prefer folks submitting data not more than 10,000, just so that we won't clog up the server, and we'll process the file. We'll get the file processed much faster. It's kind of a soft limit.
Yeah, it won't be outright rejected, but we would prefer that it stayed.
Especially at the end of the year when there are a lot of submissions.
Mm-hmm. Just waiting on some more questions.
Tess asked earlier if we have an outside vendor that creates our spreadsheets for us using the Excel template, but it's not in the MIPS template that we request, do you have to copy and paste that information over to our template? And the answer is yes. If it's not in our MIPS template, then it will be rejected and you won't have any data in the portal.
And just to reiterate, since we had the question earlier about being exempt from the promoting interoperability category, that the QPP Eligibility Lookup tool is definitely useful for any physicians that if you want to check to see if you are or are not required to participate in MIPS, or if you are or aren't considered patient-facing. All of that can be done by simply entering your NPI, and then you'll see what your status is. And if you're considered non-patient-facing, you have to do fewer improvement activities. You only have to do 2 medium-weighted or 1 high-weighted activity rather than 4 or 2. And you're completely exempt from the promoting interoperability category, in other words, the ACI category.
Corey asked, does anyone know if the cost measure has been reweighted for 2018 like it was last year? So cost for year 2 is 10%. There are 2 cost measures that can be submitted through claims. We can't submit for cost through the registry. So if there's no way to calculate your costs for 2018, the 10% does get reweighted over to the quality section. Does that help?
I think we'll give it maybe another minute for questions, and then if we don't get any, we'll just wrap it up early. All right. Well, it looks like we're all done for today. So thanks everybody so much for joining us. We hope you can join us for the August webinar as well. And as always, if you have any questions, feel free to submit a ticket to us, send an email, or give us a call. Thanks a lot. Have a great day.